Fungal infections kill more than 1.5 million people each year. Biosergen wants to develop a product for treating invasive fungal infections. Later in June, the company aims to go public on First North, and today we're going to talk to its CEO, Peder M. Andersen. Welcome, Peder.
Thank you very much.
Could you start off by telling us a bit more about the company and the problem with fungal infections that you would like to address with your product?
Yeah, I can do that. Biosergen is a company based in Norway with research facilities in an institution out there where we have done all the basic research for many years. We are developing one product in various formulation actually, and is heading towards fighting the fungus infections. That is our goal, which is the invasive ones that are having a high mortality and severe morbidity around it. So our goal is to get a product through which is called BSG-005 in a standard formulation and into nano formulations. That's our goal for the next years.
So how will your product be different from other products on the market?
Well, BSG-005 is a polyene macrolide. That's a distinct class of drugs, antifungal drugs, and they are extremely effective and has over the years always been fungicidal, meaning it kills the fungus, and it has not had any resistance development. For our product, the major difference to existing class drugs or polyenes is that we don't see any toxicity on the kidneys. That has been the biggest issue for these products in this class over the years. And they have been here for 50 years, but has mainly been as a last resort because of the toxicity.
How big is this market?
Well, if we look at our, what should we say, direct competitor, which is the other polyene called amphotericin B, this drug sells alone per year for $500 million. And if we are successful in what we are going for, we will also take some of the other markets, which are the main markets, which are in the billion-dollar class each year. So there is a big market potential out there.
When do you expect to have a product on the market?
Well, if everything goes as we would like it to and as we plan, we expect that we should be able to file a new drug application, particularly in the US in the first instant, and do that by the end of 2025. That's our goal to hit the market time.
So what are the key milestones from now to you go to market?
Well, if I should take up the list of goals that we need to achieve in the meantime, it would be long. But if I just look at the next few years, what we are looking for is to get our orphan designation through, to get our QIPD, which is an incentive program in the US that is for antibiotics and antifungals, and we fit into that one. And that would be nice because that would give us additional benefits on the market. We would have exclusivity for additional 7 years than what we otherwise would get. Then we need to have our phase 1 trial up and running and completed in Australia, starting this year. And we would need to have our manufacturer for the phase 2 program started up this year and be ready for phase 2 program next year. Then we would like to have our pre-IND meeting after the phase 1 to discuss the phase 2 and the program in general. And then, of course, it's an end of phase 2 program with the FDA, a meeting where we can discuss the phase 3 programs. Those are the key issues for anybody who is doing drug development, and we are part of that.
So once you have launched the product, what will the business model look like?
Well, we will, as a very small company, basically have to partner out. And this is something we will start to look at when we get into the phase 2 program where we can see where we are in terms of efficacy and so on. And as soon as we have those data, we'll start looking at it. You have to remember that this product and this field is a very narrow and intensive field. So we don't need a big company with many salespeople or anything. We can actually go to a very few hospitals in the world. So we will partner out a major part of the market, but possibly also keep our own fingers on some of the markets, simply because we don't need that big sales force. So this is what we're going to look for.
So last but not least, what do you see as the main risks for this project?
Well, again, let me go back and say that having a polyene macrolide product in development is a low-risk product. That means because the efficacy is undisputed. We know it's been working for 50 years, and this will continue, and we've shown that in our animal models as well. So it's a low-risk product. The biggest risks that I see is that we have like a corona pandemic that is disturbing deliveries and all that stuff, and get manufacturing in place in time for all this. Also for later on. This has caused delays just because we couldn't get things done. That's the major risk from my point of view.
So thank you very much for joining us today, Peder, and good luck with the IPO.
Thank you for having me.